Merci, Monsieur le Président. C'est avec plaisir que je me lève en chambre aujourd'hui pour poser ma première question. Et ma première question, Monsieur le Président, s'adresse à la ministre des Soins de longue durée. Aujourd'hui, c'est la semaine des infirmiers et infirmières en Ontario. Chaque jour, ils se battent en première ligne contre ce terrible virus. Ils sont essentiels à notre système de santé. Et nous leur devons d'obtenir l'équipement de protection dont ils ont besoin. Nous avons entendu de nombreux témoignages de la part d'infirmiers, d'infirmières et d'autres travailleurs de première ligne, comme les préposés aux bénéficiaires, n'ayant pas accès à l'équipement approprié, y compris les masques N95. Monsieur le Président, par votre intermédiaire, la ministre peut-elle décrire les mesures immédiates qui sont prises pour s'assurer que tous les infirmiers et infirmières et tous les travailleurs de la santé de première ligne dans les différents milieux, y compris les soins à domicile, ont accès à l'équipement de protection approprié? Merci, Monsieur le Président.
Minister of Health.
Well, I thank the member very much for the question, and welcome to Queen's Park, and we look forward to having conversations with you and questions from you in the future. But the question of personal protective equipment is very important because the people who are performing frontline care, whether it's in hospitals, long-term care homes, or in the community, they really are the heroes here. We owe it to them to provide them with the equipment that they need to properly care for their patients or residents, to make sure that they stay safe and healthy themselves, as well as for their families, because every day they need to go home and make sure that they're not going to be transmitting COVID-19 to their family members. So that is fundamentally important to us, that we do have the PPE that they need. That is why we have a system where they let us know, the organizations, what equipment they need. It's shipped to them on a daily basis, either from our regional reserves or from our pandemic reserves. And whatever equipment it is that they need at point of care, if nurses require an N95 mask for whatever procedure it is that they're performing, if it's an aerosol generating procedure,
Response?
they will have that N95 mask. That is something that we have had many discussions with the employee representatives about over many conversations, and we have agreed with them that if a nurse requires an N95 mask, it will be available to him or her to use.
Thank you very much. A supplementary question.
Thank you, Mr. Speaker, and I thank the Minister for her answer. Unfortunately, that's not the experience I'm hearing on the ground. I wrote to the Minister of Long-Term Care last week about my concerns regarding 3 long-term care homes in my writing. Nurses and staff in these homes are reporting inconsistent PPE practice, insufficient supply, staff shortages, and escalating tensions between colleagues. This is having an effect on the care and the quality of life of our most vulnerable, our moms and dads, our parents. So, Speaker, through you, to the Minister, what are you doing to ensure that nurses in long-term care have access to proper PPE and that PPE protocols are clearly articulated? Thank you, Mr. Speaker.
Minister of Health.
Thank you. Well, the appropriate PPE is being supplied, as I indicated earlier, to every long-term care home, retirement homes, to in hospitals, of course, as well. We know that that is fundamental for the people on the front lines providing care. I would say, however, there have been some situations in some long-term care homes where it's been necessary because of a shortage of staff. Staff have become ill or just have not been coming back to work since there have been outbreaks in some of the homes, that it has been necessary for hospitals to go in. We have changed the order to allow for hospitals to see long-term care homes as work sites, and they have staff that are going in with PPE, and they are making sure that in those situations where they are providing care, in some cases having to provide supervision, that there is PPE available and that it is being used according to the appropriate protocols. So we're continuing to follow that.